Hello, welcome back to this channel. Today we will talk about important medical terms. First term is diagnosis. What is diagnosis? It is the identification of a disease or a condition through evaluation of its signs, symptoms, medical history, and diagnostic tests. Next term is prognosis. The predicted outcome or course of a disease or a condition, including the likelihood of its recovery or response to the treatment, is called prognosis. What are symptoms? Subjective indications of a disease or a condition experienced by a patient, such as pain, fatigue, or dizziness. These all include symptoms of any disease. What are signs? Signs are the objective manifestations of a disease or a condition that healthcare professionals can observe or measure, such as fever, rash, or abnormal laboratory results. Symptoms are subjective manifestations of a disease that is experienced by the patients, while signs are objective manifestations that would be recorded by the healthcare professional. Next term is treatment. That is the management or the care provided to alleviate, cure, or control a disease or a condition that may include medications, surgery, therapy, or lifestyle modification. These all include treatment of any disease. Surgery is a medical procedure involving incisions or manipulations of body tissues to diagnose, treat, or repair a disease or any injury. Medication is chemical substances used to treat, cure, or prevent a disease or relieve its symptoms. What is anesthesia? It is the use of drugs to induce a temporary loss of sensation or consciousness during medical procedures, ensuring patient comfort and control. What is epidemic? Epidemic is the occurrence of a disease in a larger number of cases than expected within a particular population or a region. Pandemic. An epidemic that has spread over multiple countries or continents, affecting a significant number of population. What is contagious? A disease that can be transmitted from one person to another through direct or indirect contact. What is the term chronic? It is a long-lasting or persistent condition, often referring to diseases that persist for 3 months or more. On contrary, acute is a condition with a rapid onset and a shorter duration, often referring to diseases with severe symptoms but a relatively short course. What is inflammation? That is the body's immune response to injury, infection, or irritation, characterized by redness, swelling, heat, and pain in the affected area. Immune system. The body's defense mechanism against pathogens and foreign substances, consisting of various cells, tissues, and organs that work together to protect the body. What is allergy? Allergy is an abnormal immune response to a usually harmless substance, resulting in symptoms such as sneezing, itching, or difficulty breathing. Vaccine. Vaccine is a biological preparation that stimulates the immune system to develop immunity to a particular disease, providing protection against future infections. What is the term genetic? The term genetic refers to relating to genes, or hereditary refers to traits or conditions inherited from parents. Radiology. Radiology is the medical specialty involving using medical imaging techniques such as X-rays, CT scans, or MRIs to diagnose and treat the diseases. Rehabilitation. Rehabilitation is the process of restoring or improving physical, mental, or cognitive function and independence after an illness, injury, or surgery. Thank you for watching this video. Stay tuned to this channel for watching more informative videos like this.